Hello friends, today we'll be discussing about biofilms and how does they affect chronic wound healing. So let's start. So what are biofilms? So these biofilms are complex community of microorganisms. So these are community of bacteria which are embedded in self-produced matrix of extra polymeric substances. We'll see them in detail. So these are community of bacteria which are embedded in a matrix which they have produced themselves, which is made of extracellular polymeric substances. And these biofilms helps these bacteria from immune system and antibiotics. So these are difficult to manage and therefore creating chronic wounds and difficulty in wound healing, causing chronic infection. So how does these biofilm form? Initiated by the planktonic bacteria which are adhering to the surfaces. They multiply, these bacteria multiply and produce these EPS, and over time these biofilms mature, forming a complex structure and disperse bacteria, leading to new infections. So these are commonly very highly prevalent in the chronic wounds, and ideal environment for biofilm is moist, warm and nutrient rich environment. It impairs wound healing by creating a physical barrier, inducing chronic inflammation and protecting bacteria from immunity and antibiotics, causing delayed wound healing and wound closure, increased risk of infection, chronic pain, affecting quality of life, reduced quality of life, and increased healthcare costs. So these are impact of biofilm on the wound healing. Then the clinical manifestation, there will be persistent exudate, delayed healing of the wound, foul smell, granulation tissue will be absent or will be unhealthy, wound edges will not advance, so there will be very late healing and signs of inflammation. Challenges for diagnosis: since biofilms are difficult to culture, it is difficult to diagnose, and the wound swabs may not be able to detect these biofilms. So high index of clinical suspicion is necessary. So how do we treat these cases? So we'll need debridement to remove the biofilm. Then we'll have to give antibiotic therapy, which are often ineffective due to biofilm resistance. But after debridement, they will be effective. Topical agents, that are the anti-biofilm properties, that can be useful. Then adjunctive therapies in the form of hyperbaric oxygen therapy, negative pressure wound therapy are also useful. Then what are the steps in biofilm formation? We'll just see in detail. That is attachment, growth, maturation and dispersion. In attachment, there the free floating bacteria will adhere to the surface, which are initially reversible, followed by irreversible attachment, producing adhesive substance that firmly bind to the surface. Then microcolony formation, that is bacteria multiplying and forming clusters. Then maturation, the biofilm grows in thickness, developing complex structure with channels for nutrient and waste exchange. And lastly, dispersion, that the biofilm releases bacteria to colonize new area and start the new cycle again. So as we have seen the impact, interfering wound healing, inhibiting angiogenesis and collagen synthesis, affecting wound healing and protecting these bacteria. Complications could be due to biofilm, that the spread of infection causing sepsis, systemic infection, osteomyelitis and gangrene resulting in amputation. Some of the anti-biofilm therapies, that are the topical agent in the form of enzymes, honey, though it is not proven, silver, systemic antibiotics, adjunctive therapies as hyperbaric oxygen and negative pressure therapy as we have seen. Prevention would be optimal wound bed preparation by debridement and proper dressing, moisture management, infection control through proper antibiotics, early identification and treatment of infection. So we'll conclude after some time. Then we'll see the bacteria which are known to cause or produce biofilms. So these are diverse range of bacteria, both gram positive and gram negative can form biofilms, and their ability to form biofilms significantly contribute to their pathogenicity and antibiotic resistance. So what are these bacteria? Gram positive ones, the Staph aureus, which is a common cause of skin infection, pneumonia and endocarditis, Staph epidermidis, is also associated with medical devices infection. Enterococcus faecalis, which is seen in UTI and endocarditis. Streptococcus pneumoniae, causing pneumonia, meningitis, and ear infection. These are the gram-positive bacteria which are involved in biofilm formation. And then the gram-negative bacteria, which are the Pseudomonas aeruginosa, which is the opportunistic pathogen causing infection in the immunocompromised patients. E. coli, which is involved in UTI and GI disorders. Then Klebsiella pneumoniae, which is cause pneumonia, lung infection, bloodstream infection, the sepsis, and the UTI. Proteus mirabilis, which is known to cause UTI and wound infection. These are some of the gram-negative bacteria causing biofilm formation. Then some of the other notable bacteria, that is Mycobacterium TB, which also forms biofilms in the lung tissue, contributing to persistent TB. Burkholderia specia, which is involved in respiratory infection in cystic fibrosis patient. Candida, which is a fungus which can also form biofilms in association with bacteria causing mixed infection. So biofilm complexity research indicates that these are complex structure involving multiple bacterial species in polymicrobial communities. And matrix composition, so it is the extracellular matrix of biofilms which is composed of extrapolymeric substance EPS, which includes polysaccharides, protein, extracellular DNA, providing a protective environment for the bacteria. So this was all about biofilms, and to conclude that biofilms is a significant factor for chronic wound healing and delayed wound healing, and early recognition and appropriate treatment is crucial, and often multimodal approach is very helpful in successful managing these cases. So thank you for watching. Please like, share and subscribe, and keep studying, keep growing. Never give up because great things take time, and see you in next video soon. Thank you.